gonna do the low dye taping, and because it is the foot, not a lot of hair, and the foot is gonna sweat once they go put their sock and shoe on, we like to use tape adhesive, but for class purposes, we're not actually gonna use that. It's very hard to pull off the tape, especially if they're not gonna sweat. So the anchor remains underneath the metatarsals. So I'm gonna place that horizontally across the top and the bottom of the foot. So I'll just start here. I could stand up and do it if you prefer to stand up, just to be able to get the leverage to go around the foot. But after that, the rest of the taping is gonna be underneath. Make sure that adheres. So you can see there's a little lack of adherence, so the spray really does help on this aspect. Our foot sometimes can also be kind of oily, and that's another reason why the tape might not stick. Just make sure your patient is in this dorsiflex position for the anchor, and make sure they don't have any lotions on, because if they do, the tape will not stick. So in class, just make sure you're not having any lotions on your lower extremity for this taping. The low dye is a little bit different. We are going to use the split in the tape, which makes kind of like a 1/2 inch tape. And what you're going to do is you're gonna create these teardrops. So when we pull off the tape, we're actually going to start at the base of the first metatarsal, right where that anchor is, and we're gonna go along the side, supporting a different part of our foot, and we're gonna come up across, and we're always gonna end at the same metatarsal that we started with. And you'll see where this taping gets its name, and that comes from the teardrop that you're seeing there. Now the next one, I'm actually going to start at a different location, but I'm gonna do the same technique. So I'm repeating this technique over and over, 1/2 inch tape. Now I'm gonna start at the second metatarsal. You'll see I'm doing the same thing, smooth it out so that it's not fraying and bowing up. Gentle behind the Achilles so that we don't cause a blister. Pull up and across, ending right where I started, making sure I tear that tape nice and even. Then I'll just keep going. Now I'm gonna go with the third metatarsal. Same technique, along the foot here, just along the outer edge, and then I'm teardropping it and going back to the third again. When I come back this way, now that I'm at the third, what I like to do is go to the fifth and then the fourth, just because I find that a little easier. So I'm going to start on that outer edge because this is the teardrop. And then I'm going to gently go under, not applying any pressure. And I'm going to pull as soon as I'm past the Achilles area, and I'm going to finish where I started. And that tape's a little long, so I'm just going to rip it so it stays on the anchor. Okay? Last one. Gonna go from the fourth toe to the fourth toe. And you'll see that you pretty much cover almost the entire. I have a little gap here, so we don't like gaps because it pinches the skin. So I'll actually just cover that up so we don't see it. And this would be the teardrop that you end up with right here. And then we could go ahead and add the supportive horseshoe strips along the entire arch. This will lift the arch up and recreate the arch that has fallen or that needs some help. Smooth everything out. One more strip, just at the bottom of the teardrop. So you can see there still is the teardrop. I covered it a bit. This would be that teardrop taping for the arch.